Hello, welcome to Anatomy DAHAR series. This is Dr. Abdul Hamid. Today's topic is pharyngeal muscles. Free medical education, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Sphenoid bone. We are seeing the sphenoid bones from behind, posterior view. This is the body of the sphenoid. These little two processes are lesser wings of the sphenoid. These two processes are greater wings of the sphenoid. On each side of the body coming down are a pair of plates. This is medial and lateral pterygoid plates. This is medial and lateral pterygoid plates. Medial pterygoid plates, this is the posterior sharp border of the medial pterygoid plates. When you come down at its lower end, there's a little process there called hamulus of medial pterygoid plates. This is the diagram of the base of the skull seen from below. This is in front, this is behind. Okay, let's see the structures of the base of the skull. This is the biggest opening here, called foramen magnum, number 1. On either side of it is occipital condyle, which articulates with the first cervical vertebra, that is the atlas. Anterior and slightly lateral to it is the carotid canal. More anterior and slightly medial is petrous part of the temporal bone. Temporal bone consists of many parts. This is called petrous part of the temporal bone. Number 4. Number 5, that is a little tubercle right anterior to the foramen magnum, is called pharyngeal tubercle. Okay. Then more anterior, if you see on each side, we have medial and lateral pterygoid plates. This is medial pterygoid plates, right and left. This is upper part and this is the lower part of the medial pterygoid plate. This is posterior sharp border of the medial pterygoid plate, both sides. Posterior sharp border of the medial pterygoid plate. If you come down here, this is a little process at the lowest part that is called hamulus of the medial pterygoid plate. Let's see few structures. They are structures seen from the left medial side. That means looking from inside. This is pharyngeal tubercle at the base of the skull, anterior to the foramen magnum. This is styloid process. This is hyoid bone. This is lesser horn and this is greater horn of the hyoid bone. Between the styloid process and lesser horn of the hyoid bone is stylohyoid ligament. This is thyroid cartilage. This is cricoid cartilage. This small little cartilage is arytenoid cartilage. From its anterior process, we have vocal cord. This is the level of the vocal cord, which is covered by mucosa and formed vocal fold. This is medial surface of the mandible. This is mylohyoid line. This is medial pterygoid plate. This is posterior sharp margin of the medial pterygoid plate. This is the lower end of the medial pterygoid plate called hamulus. Between the hamulus of the medial pterygoid plate to the mandible, we have raphe called pterygomandibular raphe. Pharyngeal muscles. The pharyngeal muscles are skeletal muscles. This is the pharyngeal muscles. In the upper part of the pharynx, they are under voluntary control. However, in the lower part, their function is mixed with some involuntary control. Pharyngeal muscles are arranged in two layers. A. Outer layer of circular and B. Inner layer of longitudinal muscles. The outer layer comprises a total of 3 pairs of circular muscles, 3 on each side, called constrictors. They are 1. Superior constrictor, 2. Middle constrictor, and 3. Inferior constrictor. B. The inner layer comprises a total of 3 pairs of longitudinal muscles, 3 on each side, called elevators muscles. Let's see the diagram first. We are looking at the right longitudinal pharyngeal muscles looking from behind. This is base of the skull. This is styloid process. This is auditory tube. This is palate, soft palate. And here is the pharyngeal part. Okay, let's talk about 3 muscles. The first one is palatopharyngeal muscles coming from the soft palate to the pharyngeal region. Number 2 is stylopharyngeal muscles coming from the styloid process to the pharyngeal region. And 3 salpingopharyngeal muscles, salping in Greek means trumpet, coming from the auditory tube to the pharyngeal region. They are located deep to the outer constrictor muscles. Pharyngobasilar fascia. In the diagram, this is a pharyngobasilar fascia. Although the pharynx begins superiorly from base of the skull, the pharyngeal muscles do not extend up to that. You can see pharyngeal muscles do not extend up to the base of the skull. There is a gap between the base of the skull and the upper border of the pharyngeal muscle. The gap between the pharyngeal muscles and the base of the skull is filled up by a rigid membrane, the pharyngobasilar fascia. This is the one, pharyngobasilar fascia. It is a fibrous thickening of the submucosa. Anteriorly, the pharyngobasilar fascia is attached to the posterior sharp margins of the medial pterygoid until to the humulus. Pharyngobasilar fascia is explained in detail already in Anatomy DAHAR series, the pharynx, introduction and layers. This is a schematic diagram of the outer layer of the pharyngeal muscles, that is sphincter muscles and pharyngobasilar fascia. This diagram is seen from in front. You can see here, these are the constrictor muscles. This is the inferior constrictor, middle constrictor, superior constrictor. They are stacked on one another. Above the superior is the middle constrictor. Above the middle constrictor is the superior constrictor. Above it, we have a gap there between the base of the skull and the superior constrictor, which is filled by pharyngobasilar fascia. So anteriorly, we have big opening is there, gap is there, connected to the nasal cavity, oral cavity, and the laryngeal cavity. This is the same structures looking from behind, posterior view. This is base of the skull. This is the pharyngeal tubercle in front of the foramen magnum. This is the inferior constrictor muscle. Above it is the middle constrictor muscles. Above it is the superior constrictor muscles. And above that, the gap between the base of the skull and the upper border of the superior constrictor muscle is the pharyngobasilar fascia. So they are arranged like flower pots, stacked one on another. Now we are going to talk about the attachments of the individual muscles. We are going to start with the superior constrictor muscles. We are going to talk about anterior attachment. Look here very carefully. We have two diagrams are there. They are totally different view. This is the right wall looking from lateral side, outside, lateral view. This is the left wall looking from inside, medial view. So this is the right wall looking from outside. This is the left wall looking from inside. But structures are the same. Here this is the sharp posterior margins of the medial pterygoid and hamulus. Same thing, sharp posterior margins of the medial pterygoid and hamulus. Here is pterygomandibular raphe, and here this is the medial surface of the mandible. Mylohyoid line is there. This is the posterior end of the mylohyoid line. There's a little area above this on the medial surface of the mandible. If we know all these things, we can talk about the anterior attachments of the superior constrictor muscles. Number 1, superior constrictor muscles is attached to the lower part of the posterior sharp margins of the medial pterygoid. Only the lower part of the posterior sharp margins of the medial pterygoid. Then it is attached to the tip of the hamulus. Then it is attached along the pterygomandibular raphe. Then number 4, it is attached to the medial surface of the mandible, just above the posterior end of the mylohyoid line. Just above the posterior end of the mylohyoid line, this medial surface. They are anterior attachments of the superior constrictor muscles, seen from outside and seen from inside. Continuation of the superior constrictor muscles. We are going to say something. This is the pharyngeal tubercle here at the base of the skull in front of the foramen magnum. Okay, this is thyroid cartilage. Inside the thyroid cartilage, we have the vocal folds. Okay, now we are going to continue about the superior constrictor muscle. From the origin in front, the superior constrictor muscle sweeps around posterior and the fibers diverge like a fan. The uppermost fibers attach to the pharyngeal tubercle. This is the one pharyngeal tubercle at the base of the occipital bone in front of the foramen magnum. Once we say pharyngeal tubercle, you should know where it is. I've already shown that one. Its inferior fibers, that is inferior fibers of the superior constrictor, extend far down to the level of the vocal folds, deep to the middle constrictor muscles. Now, this will coming down right up to the vocal folds, because like a cups stacked on another cup, so this one will be inside the middle constrictor muscles. The rest of the fibers in between sweep behind and meet the fibers of the opposite side along the midline pharyngeal raphe at the back. Okay, we know what is the raphe. So sinus of Morgagni is the lateral gap between the superior constrictor and base of the skull. This is the lateral gap, is the sinus of Morgagni. We are going to talk about the middle constrictor muscles, anterior attachments. Very similar to the superior constrictor muscle, these two diagrams are, this is the right wall looking from the lateral side, that is the lateral view or outside view. And this is the left wall looking from the inside, that is the medial view. Now this is styloid process. This is lesser horns and greater horns of the hyoid bone. This is stylohyoid ligaments. Now we are going to talk about the anterior attachments of the middle constrictor. Number 1, middle constrictor is attached to the lower part of the stylohyoid ligament and to the lesser horn of the hyoid bone and to the greater horns of the hyoid bone. This is anterior attachment. Posterior attachments of the middle constrictors are, as you know, the fibers diverge upwards and downwards as they sweep backwards outside the lower part of the superior constrictor. As I have said, like a stack of the cup, the superior constrictor lower part will be inside the middle constrictor. These fibers meet at the fibers of the counterpart at the back along the midline posterior pharyngeal raphe at the back there. The lower fibers of the middle constrictor reach as far as the vocal folds, deep to the inferior constrictor muscles. It comes down as far as the vocal fold here. Now, inferior constrictor, we are going to discuss about the anterior attachments of the inferior constrictor. You can see here, this is a thyroid cartilage, this is a cricoid cartilage. This is the lateral surface of the thyroid cartilage, is the oblique line is there. This diagram is right wall seen from outside lateral view. This diagram is the left wall seen from inside medial view. That's why you can see mylohyoid line is there. So let's talk about the attachments, anterior attachments of the inferior constrictor muscles. Inferior constrictor muscles has two parts. This is the superior part and this is the inferior part. Superior part is called thyropharyngeal muscles because it arises from the oblique line of the thyroid cartilage. The inferior one is the cricopharyngeus muscle. It arises from lateral surface of the arch of the cricoid cartilage. These are the origins of it. So this is the superior one, thyropharyngeus, inferior one, cricopharyngeus muscles. Look from inside. Inferior constrictor muscles. It has two parts. The upper thyropharyngeal part, which comes from the oblique line of the thyroid cartilage, and the lower part, cricopharyngeal part, coming from the side of the arch of the cricoid cartilage. The fibers of the thyropharyngeal part curve backwards and upwards around outside the lower part of the middle constrictor to the midline pharyngeal raphe at the back. Cricopharyngeal part extends from the lateral part of the arch of the cricoid cartilage of one side, sweeps around uninterrupted and attached to the lateral part of the arch of cricoid cartilage of the other side. It does not have raphe at the back. So all the constrictor muscles have raphe at the back, that is superior, middle and thyropharyngeal part of the inferior constrictor have raphe at the back, except cricopharyngeal part of the inferior constrictor. This is the schematic diagrams of constrictor muscles and pharyngo-basilar fascia. These are the constrictor muscles. This is the inferior constrictor muscle. This lower part is cricopharyngeus. This upper part is thyropharyngeus of the inferior constrictor. Above it is middle constrictor. Above it is superior constrictor. And above it is pharyngo-basilar fascia. throughout anteriorly open and connected to the nasopharynx, oropharynx, and laryngopharynx. But this diagram is we are looking the same thing from behind. Here is the base of the skull. This is the pharyngeal tubercle is there. Here are the muscles. This is the superior constrictor. This is the middle constrictor. This is the upper part of the inferior constrictor. That is your thyropharyngeal muscles. Above the superior constrictor and between the base and superior constrictor is the gap which is filled by pharyngo-basilar fascia. Throughout, if you see all these three parts, at the back we have median, posterior median raphe is there. So fibers from right side and left side will meet here. Okay. However, if we come down to the cricopharyngeal part of the inferior constrictor, there is no raphe is there. Why? If you look back this one, this is cricopharyngeal muscle. The fibers are coming from the lateral side of the right arch of the cricoid cartilage. These muscle fibers will go around without interruption and come and attach to the lateral surface on the left side of the cricoid cartilage. So this cricopharyngeal muscle has no raphe at the back, no interruption. They are arranged like flower pots stacked one on another. All these muscles are. Look at this diagram. This is vocal fold. We knew that posterior wall of the superior constrictor, middle constrictor, and thyropharyngeal muscles overlapped and end at this level. So, Killian dehiscence, junction between the lower fibers of the thyropharyngeus and upper fibers of the cricopharyngeus near the posterior midline is a potential weak area. That is, junction between these fibers and these fibers, this area is potentially weak because there is absence of overlapped muscle at this site. So through this area, a pouch of mucosa and submucosa may protrude, called pharyngeal or Zenker's diverticulum, Killian's dehiscence. It is below the level of the vocal fold, around this. Killian's dehiscence is attributed to the neuromuscular incoordination in this region, which may be because the two parts of the inferior constrictor have different nerve supply and different muscle fibers type. Killian's dehiscence. This is the thyropharyngeal part and this is the cricopharyngeal part of the inferior constrictor. The propulsive thyropharyngeus is supplied by the cranial accessory nerve through the pharyngeal plexus. The sphincteric cricopharyngeus, in addition to the cranial accessory nerve, it also receives the external laryngeal and the recurrent laryngeal nerves. If in the case of neuromuscular incoordination, the cricopharyngeus, which is low twitch type of muscle, fail to relax when thyropharyngeus contracts during swallowing. Raised intrapharyngeal pressure forces bolus of food backwards through the weak part and tends to produce a diverticulum. It may be downward directions, usually on the left side. B. The inner layer of pharyngeal muscles. It comprises of 3 pairs of longitudinal muscles, 3 on each side, called elevators. Let's see the diagram first. This is the diagram seen from behind. This is right side. This is base of the skull. This is styloid process. This is auditory tube, and this is soft palate. This region is pharyngeal region. So the inner layer consists of 3 muscles on each side. They are 1. Palatopharyngeus, coming from palate to the pharyngeal region. Number 2. Stylopharyngeus, coming from the styloid process to the pharyngeal region. And 3. Salpingopharyngeus. Salpings in Greek mean trumpet, coming from the auditory tube to the pharyngeal region. They are located deep to the outer constrictor muscles. Longitudinal muscles, they are inner group of pharyngeal muscles. We have 2 diagrams here. This is lateral wall looking from inside, medial view. This is lateral wall looking from outside, lateral view. Okay, let's see the structures here. This is auditory tube. This is soft palate. And this is the pharyngeal region. In this diagram, here is the soft palate. And here is the styloid process. This is the pharyngeal region. So, inner groups of muscles, 3 longitudinal pharyngeal muscles are number 1, palatopharyngeus, coming from the soft palate to the pharynx, coming from the soft palate to the pharynx. Number 2, stylopharyngeus, coming from the styloid process to the pharynx. And the third one is salpingopharyngeus, coming from the auditory tube to the pharynx. They are 3 inner groups of muscle, longitudinal pharyngeal muscles. Actions of the pharyngeal muscles. The constrictor muscles, all except the cricopharyngeus, have the successive contraction of the constrictor muscles from above downwards, propels the bolus of the foot into the esophagus. The longitudinal muscles are relaxed during this phase. After the foot enters the esophagus, the longitudinal muscles contract to shorten the pharynx and pull the larynx up. Cricopharyngeus is round and thick. It acts as a sphincter at the lower end of the pharynx. It is always closed except for momentary relaxation during deglutition. It prevents air from being sucked into the esophagus. Structures through the gaps between the pharyngeal muscles. Let's see the diagram first. This is base of the skull. This is superior constrictor muscles. This is middle constrictor muscles. This is inferior constrictor muscles. And this is esophagus. There are gaps between all these structures. The uppermost one is the gap between the base of the skull and upper border of the superior constrictor muscles. The structures going through are auditory tube, levator palatini muscles, ascending palatine vessels, that means artery and vein, and palatine branch of ascending pharyngeal vessels, arteries and veins. Next is between the superior constrictor muscles and the middle constrictor muscles. The structures are stylopharyngeus muscles, coming from the styloid process, and glossopharyngeal nerve. Next is between the middle constrictor and inferior constrictor muscles. Structures are internal laryngeal nerve and superior laryngeal vessels, artery and vein. Lastly, structures between the lower margins of the inferior constrictor and esophagus are recurrent laryngeal nerve and inferior laryngeal vessels, arteries and veins. The end. Anatomy DAHAR series, free medical education. Nerve and blood supply of the pharyngeal muscles. Please refer Anatomy DAHAR series, neurovascular supply of the pharynx. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.